Composite bonding can be used to some extent where a tooth is missing to reduce the gaps. Composite bonding is a fantastic, cost-effective treatment that can completely change or make very minor changes to the appearance of your teeth or your smile. It doesn't involve any injections or any drilling. It's a completely reversible procedure, but it can be used to change the shape, color and alignment of your tooth or teeth. When the teeth are slightly crooked, we can use composite bonding to camouflage the crookedness and make them appear straighter than they actually are. This is really useful in very mild cases of crowding, but where there is more severe crowding, we usually advise a course of orthodontic treatment with something like Invisalign first, and then often the composite bonding can be used at the end as the icing on the cake to get really perfect results. Bottom teeth can be much more prone to chipping and wear over time than upper teeth because of the way the teeth come together. Composite bonding can be used to reverse the damage that's been done by this aging process over time and leave the lower teeth looking completely intact and youthful again. For small and slightly gaps that are unaesthetic and that people don't want to keep, composite bonding can be used really successfully to make the teeth effectively very slightly wider and thereby either reduce or eliminate the gap. If a gap is very large between the teeth, we may recommend orthodontic treatment first, sometimes in combination with composite bonding at the end to create really beautiful results. The length of time composite bonding lasts depends on many factors, mostly how extensive it is and how well it's been done, but also how well it's looked after afterwards. Typically, we would expect this to last about 5 to 7 years, but the things that will tend to impact it most are things like clenching and grinding, and sometimes we'll advise that you wear a night guard to protect the composite bonding at night time, and also things like your diet and oral hygiene. For mild cases of overlapping teeth, we can use composite bonding to make the teeth appear straighter than they actually are. This can be really effective in particular cases, but sometimes we will advise a course of orthodontic treatment with something like Invisalign to correct the overlapping first, and then sometimes either the composite bonding isn't necessary or we can use it for the final touches to get a really nice result. Composite bonding is the perfect way to restore a chipped or a broken tooth. Even where a tooth is really severely fractured after an accident, composite bonding can be used to completely restore the tooth to its original shape and color, and when done properly, will make it appear that the tooth is never broken. Composite bonding can be used to change the color of the teeth effectively by covering up a dark or discolored tooth. Sometimes we'll use composite bonding in combination with a treatment like internal bleaching of dead or root canal treated teeth to get really perfect results. Often we will recommend composite bonding after a course of orthodontic treatment such as Invisalign, particularly in adults. This is because often by adulthood, if the teeth are crowded, they've become slightly unevenly worn, and so once they are completely straightened up, they won't be completely level at the top. For these cases, we use composite bonding at the end as a way to restore the damage and the wear that's happened to the teeth before the orthodontic treatment, so we get really beautiful looking results. It is technically possible to repair a broken porcelain crown with composite. However, the bonding is not as predictable as with a natural tooth, and also because the composite and the crown are made from different materials, it's very difficult to get a really perfect result. And where a crown is broken and needs to be repaired, the ideal replacement is to replace the crown. Composite bonding can be used to some extent where a tooth is missing to reduce the gaps. However, there's a limit to how far we can take this, and if there's a large gap with a full tooth missing that hasn't naturally closed at all, then composite bonding is limited in how much it can close this, and we certainly wouldn't try to replace an entire tooth just with composite. For this, we would ideally use something like an implant or, in some cases, an adhesive bridge. Where there is any existing active gum disease, we will always recommend treating this first before having any cosmetic treatment like composite bonding done. It's very important that the gums are healthy when we do the composite bonding for long-term stable results. One very common side effect of treating gum disease is that the gums can recede slightly as they heal, so little gaps form between the teeth, and composite bonding is a beautiful way to mask these gaps and make them look much nicer. However, it's very important that the composite bonding is done to a very high standard, because any ledges or any problems with the composite that make cleaning more difficult will tend to cause the gum disease to relapse. Composite bonding has an ever-increasing range of uses in cosmetic dentistry and can be a really beautiful, cost-effective way to make changes to the appearance of a tooth or our teeth. Whether it's a small issue about one tooth that bothers you, or you're considering a full smile makeover, composite bonding may be the ideal answer for you.